Hi friends, this is Dr. Preeti Vyas from Sangeeta Hospital, Andheri West. I'll be talking to you today about certain small tips of traveling in pregnancy. There are so many times, friends, when I come across people who come and ask me, Ma'am, I want to take a trip to Maldives. Ma'am, I want to go to Dubai. Ma'am, can I go to London? And all this during pregnancy. And I got, oh my God, do you really need to travel? It's so scary when your patient wants to take these long trips abroad and you don't know whether to say yes or no, because sometimes it's for work, it's not always for pleasure that they are traveling. So I'd like to give you all some tips. This last week when I was talking to one of my working women, she said, Doc, can you give me a certificate that I need to be on bed rest? I said, why? You're doing absolutely fine. What do you need bed rest for? No, you know what, doctor? I stay in Andheri and my office is in Marol. So every day I have to travel by rickshaw or car for 20 minutes. What if something goes wrong? What if something happens to my baby? I'm like, oh my God, woman, come back to reality. You don't need to stop working. A 20-minute travel by rickshaw or a car and you are scared, you're panicking. People travel from Virar to Churchgate. I mean, that's a long journey, in the train with a full-term pregnant womb and they're fine. So what we need to understand is be practical. You don't need to stop working. You don't need complete bed rest for something like this. So I'll tell you what all is allowed in pregnancy, what kind of travel is fine. Let's take road travel. A short trip going to office, short trip less than an hour. Please, you just don't need to be scared at all. Yes, the only tip I would want you to have is definitely wear your seat belt. Okay, because it's just plain, simple safety that we are talking about. So even if you are traveling all the way up to an hour away or 2 hours away for work, that's perfectly fine. Wear a seat belt. You can drive too. I usually tell my patients that up to the 5th month drive absolutely. But beyond the 6th month, when the tummy is jutting out, you need to be a little careful. Usually it's not us who are at fault. A person who's behind you may be at fault and they may land up backing into your car and the steering wheel can straight come and hit the tummy. So we need to be a little careful. So if you can manage to get somebody who will drive you around in the last trimester, that's really worth it. Now this is about short road travels. What about long trips? Yes, you can take long trips also for a road travel, but make sure that it's a well padded cushion that you're sitting on so you're not uncomfortable. Make sure again the safety features are taken care of. You're wearing a safety belt. Make sure that you're taking enough breaks so you're not just sitting at one place all the time. Try and take a road which is not bumpy. Try and take a nice smooth road so that you just don't feel the jerks and you don't end up getting backaches. Try and walk around, in between every 2-3 hours. Like take a break to have something to eat, take a break to go to the washroom in between. So that way you're walking around and not just stationary at one single place. Make sure that you're well hydrated even while traveling. What about air travel? Usually I tell my patients not to take air travel in the first 3 months. Not that anything goes wrong. Most of the time pregnancy remains safe. But it's just that there is a pressurized aircraft and the pressure changes of the atmosphere which happen at the high level can interfere sometimes with the blood circulation. So we just need to be a little safe. So I usually tell my patients try avoiding air travel in the first 3 months. Last 3 months anyway, most airlines don't take pregnant women. Beyond 32 weeks, most airlines refuse to take a woman. Purely for the reason that what if she lands up having a preterm labor or a preterm pain. What about train travel? Train travel is absolutely safe. You're able to walk around, you're able to lie down, you're able to sit. It's quite a comfortable journey. So in fact, a train travel can be taken even in the first or the third trimester. Even if it's a 8 hours journey by train, that's perfectly fine. Of course, if you are close to the due date, then you need to take a certificate from your doctor because you need to be sure that you're not going to land up delivering in the train. You don't want a free railway pass, for a lifelong for the child. And what about walking up, walking down the stairs? while you are working, while you are going to office. That's in fact means I tell my patients, I encourage them to please do that because that's actually a free workout that you're getting. So friends, feel free to travel in pregnancy, but just make sure you're following the safety tips. See you soon. Next week, I'm going to tell you all some tips about what is safe, what cosmetics can be used in pregnancy. Can I undergo spas? Can I undergo some treatments? Can I go to the parlor? What all things can I do, and how else can I indulge myself during pregnancy? See you soon. Bye friends.
If you like our video, please subscribe, like and share our videos. And if you want, you can press the bell button that will help you to get the fresh updates every week.